Dear colleagues, it is an absolute honor and pleasure to be able to present this webinar to you. My name is Professor Firas Al-Niaimi. I'm a professor in laser and dermatology based in the United Kingdom. And this webinar is on how I see the Frax Pro device from Candela in clinical practice. And I'll be giving you some tips on how to utilize this wonderful device in your practice. Now, before I start, I'd like to pose a few questions. And this is the first question. If we look at these stones, and if you look at the left side, which is A, and the right side, which is B, which ones are more appealing? Which ones look prettier? Now, we will come to this question later in the webinar. And the second question I would like to also pose, which is one of the other wonderful devices from Candela, which is the picoway, the picosecond laser. And I just have a very simple question. Would a lower fluence on the 1064 Nd:YAG picoway work in a comparable fashion to the 532 wavelength? And you will see later why I have posed this question. The third, and I promise this is the last question, is if I am faced with Sharon, who is one of my patients, who comes in to just look better, would more collagen or collagen-related treatments really be what she would be looking for? Or would she get better results by simply improving her tone and pigments? Again, I have a reason why I am posing this question, and we will come back to all of these questions later in the webinar. Now, before I start talking about the device itself, let's just go through some facts. And the fact is that facial rejuvenation is a growing and important part of any cosmetic dermatology practice. I have been traveling around the world giving lectures in various continents and countries, and I see the same trend, and that is facial treatments, whether it's toxins, injectables, fillers, energy-based devices, are a cornerstone of cosmetic dermatology treatments. And we have also lasers, both in the fractional and non-fractional mode. When we talk about fractional lasers, we divide them into ablative lasers, such as the carbon dioxide or the erbium YAG, but they carry the risk of downtime and some complications. When we talk about the non-ablative lasers and the non-ablative fractional lasers, we really talk about wavelengths between 1200 and 2000 nanometer. And understanding this is important too, because within this range of wavelengths, you have water absorption, but the water absorption is not the same for, let's say, 1300 or 1900 nanometer. There is still a difference in the absorption coefficients to water within this range. And therefore, the Frax Pro sits in a very unique position. And why is that? And that is because the Frax Pro has two wavelengths within that range of the non-ablative wavelengths that are absorbed primarily by water as a chromophore, but there are two different wavelengths, and therefore there is going to be two different tissue interactions. So we have the 1550 nanometer wavelength that is more, because it's less absorbed by tissue water compared to the 1940, the 1550 is more designed for deeper remodeling. So that is deep dermal treatments. Whereas the 1940, because it's highly absorbed by tissue water, it's going to be more for superficial resurfacing, predominantly epidermis and the superficial layer of the dermis. So this is very important. So the first thing, really, the first key message to take home from this webinar is that we have two wavelengths, both of them for water as a chromophore, but these two wavelengths have different absorption spectra for tissue water. You can see here the 1550 has less lower water absorption coefficients compared to the 1940, and therefore the tissue interaction is going to be different, particularly the way it interacts with the skin in terms of depth and also what we get on histology. And this is very important, and this is histology done by the company Candela on this device, the Frax Pro, using the two different wavelengths. And what you see, which is very interesting but important from the clinical perspective, and when we are using the 1550, as I said, because it has less water absorption compared to the 1940, it penetrates deeper because it allows more of that wavelength to get through the skin, because not all of it is going to be absorbed by the tissue water. Remember, the skin is 60 to 70% composed of water. And therefore, the 1550 is more suitable for dermal remodeling. So when we have a dermal issue, such as scarring, deep wrinkles, we are going to use the 1550. On the right-hand side, where you see the 1940, you see the histological changes on the skin when we are using the 1940. And because the 1940 as a wavelength is highly absorbed by tissue water, much more compared to the 1550, it will absorb all of that light as soon as it hits the skin, and therefore it will not penetrate deep. Therefore, it will not penetrate deep, and you will see that there is this histological change with the clefting and this cracks in the surface of the skin. And therefore, this is more suitable for epidermal resurfacing and remodeling of the superficial aspect of the dermis.
That's about the Frax 1940. And that's not. This is
sorry. So these are examples of what you can use with the 1550. So for example, here we have a scar and there is redness. So of course you can use the Nautilus IPL handpiece first to take out the redness, but the 1550 is the wavelength that we're going to be using for the scars. So I want to focus my talk predominantly on the 1940 wavelength, because that is the new wavelength that is with this device, and that is so different from many of the other wavelengths that we have. So once again, on the 1940, if you can see here on the image, the penetration is very superficial, and therefore it's suitable for superficial pathology. Whereas with 1550, it's deeper and it's desired for more deeper pathology. So why do I think, and why do I in my practice have both wavelengths, and why do I think you should have both wavelengths? And that is because in clinical practice, we see all of these cases. We are presented with patients who need epidermal resurfacing, tone, texture improvements, superficial epidermal pigments. But we also have patients who present to us with scars, pores, stretch marks, general rejuvenation in terms of fine lines and wrinkles. And this is why I think the Frax Pro is unique, because it allows us to customize the treatments, even within the same patient. So you can use the 1550 first, and then followed by the 1940. Now, this slide is important because we know that there is a thulium in the market that has a 1927, and you're right to ask, well, is there going to be a difference between the 1940 and the 1927? And the answer is yes, and that is in favor of the 1940, because the highest peak of water absorption before it becomes ablative is around 1935 nanometer, which is much closer to the 1940 wavelength compared to the 1927. This is the interface of the device. So this is on the Frax 1550, and you can see you have the diameter width on the far left. You can see that it shows 10 millimeter here, but you are able to adjust the scanner width from a very narrow scanner width of 4 millimeter to the widest scanner width, which is 12 millimeter. And this is, again, a unique thing which does not exist in any of the other devices in the market, even with the same wavelength. And that is, for example, if you want to use it for a large treatment area, you'll use the wider scanner width. But if you have discrete small areas where you want to do very intense treatments, you can then choose a narrow scanner width. For example, if you're also working around the eyelids in delicate areas and you want to be very precise, you can then again choose the narrow scanner width. You see that there is the energy, which you can dial up or dial down. And then next to it on the right-hand side, you can see the coverage, which is essentially the percentage density. And again, you can dial that up for more intense treatments with a higher density, or dial that down for lower density for some lighter treatments. And this, for example, would be suitable if you're treating higher skin types and you want to have less intense treatments, or if you deliberately want to have very intense treatments, then you can increase the density. What you see in terms of the estimated depth is you can see that precisely for each fluence you're choosing, the device is going to tell you the estimated depth. And that's very helpful because you're able to adjust your fluence based on the estimated depth that you want to reach. And the passes where you see that below, that essentially means that to achieve the 25% density on this chosen fluence, you need to do 3 passes. Now, here is a tip. If you, for example, want to have very intense treatments, you can then add in 1 or 2 passes more than what the device is suggesting you. On the other hand, if you want to do a very conservative or light treatment, you can then just do 1 or 2 passes less than what the device is suggesting you. And this, again, is an important slide because what it shows is that as we decrease the scanner width, okay, so you don't need to change the roller, it's the same roller, but it's all a scanner. So as you press a button and decrease the scanner width, you see that the spots are coming closer together. Whereas when you increase the scanner width and go to the maximum scanner width of 12 millimeter, you'll see that the dots are further separated away from each other. And why is that important? That is important is because when you, for example, let's say you treat a higher skin type and you want to be conservative with the density to reduce any risks of complications, then it's preferable to use the 12 millimeter diameter scanner width, so you can see that the spots are further apart from each other, and use a lower density, but you can then do more passes because that low density, wider scanner width will allow enough time for the heat of each spot to dissipate, and therefore you don't have bulk heating. On the other hand, if let's say you have a superficial seborrheic keratosis, flat seborrheic keratosis, or a large solar lentigo on a light skin type patient, and you really want to treat that intensely, then you can choose the 4 millimeter diameter scanner width with high density, do multiple passes, almost semi-ablating it. And this customization with the scanner width, to me, is a unique feature, and to me is what makes the Frax Pro so unique and superior compared to all the other devices in the market with comparable wavelengths. So once again, the scanner width is adjustable from 4 to 12 millimeter diameter, which is a huge benefit. The density is adjustable too. The fluence relates to the depth. And so, as I say, if you want to have a light treatment for someone who wants much less downtime and doesn't mind having a few more sessions, then you can choose a low density and just do fewer passes. On the other hand, higher density with more passes is going to give you more intense treatment. Now, for those of you who paid attention to the estimated depth in the previous slide, when I showed the 1550, you saw that the depth was in around the 700 micron. And if you now just pay attention, and this is the Frax 1940 handpiece, if you pay attention to the estimated depth here, that is 170 micron. So you already can see that these two wavelengths are going to give us different depths of penetration. Here we are very superficial, and this comes back to the second question I asked, whether the 1064 wavelength on the peak away lower fluence is going to act similar in a similar fashion to the 532. The answer is going to be no. And that is because these are two different wavelengths with two different tissue interaction. And the reason I'm saying this is only because I have few colleagues who say, well, with the 1550, perhaps if I use lower fluence, I'm going to be superficial and I'll be able to simulate the 1940. Now, that is a good thought, but it is not going to happen simply because of the physics and the tissue interaction. So the 1940 is going to act very differently compared to the 1550. And here is Sharon again, having had the 1940. And you can see the degree of improvement, not just, and I don't want you to just look at the pigmentation and the clearance of the pigmentation, because you may say, well, I have a Q switch or a Pico or even an IPL that can get rid of the pigmentation, but the texture of the skin is smoother, it feels smoother, it's glowing. Sharon is very happy, not just with the reduction of the pigment, but the whole skin feels better, it's smoother, she loves the texture. And this is, in my opinion, something that is difficult to achieve with pigment-specific lasers or an IPL, and this is the advantage of the Frax 1940 wavelength, where in addition to the superficial pigment that you get as a secondary mechanism of clearance, you get this smoothening of the skin, the softening of the skin with the glow. So the skin just feels better, looks better, and very smooth. Another example here. So it's not just the clearance of the pigment, but all the patients report that the skin is feeling smoother with the glow, the makeup sits nicer, and it's just a better skin. Now, the chest and décolletage always has been a challenge. It's not an area that you will feel comfortable treating with the ablative laser. We all know, even with the fractional ablative. And yes, we can treat the pigmentation with the IPL, but once again, it's not just about the pigment, but the skin surface feels smoother and nicer. This is just one single session, but of course, with multiple sessions, you are going to get better results. And what's important about these treatments is that there is very little downtime. And there are combination approaches that you can use with the Frax. So, for example, if you have the picoway, which is the picosecond laser of Candela, what you can do is you can treat the individual lentigos with the zoom handpiece of the picoway, and then use the Frax 1940 on the whole face, or even combination of the 1550 and the 1940. So what you then do in a single session is you can blast all the lentigos and then just finish off the treatment with this fractional non-ablative. If you don't have the picoway and you have the V-beam perfector, you can use a compression handpiece. So you can use a compression handpiece of the V-beam perfector and hit all the individual lentigos and then finish that off with the Frax 1940. But if it was a mature patient and you also want to do more deeper rejuvenation for the fine lines and wrinkles, you can combine that with a 1550, all in the same session. HIFU, which stands for high intensity focused ultrasound, which is a very popular treatment for lifting and tightening, can also be combined with the Frax. So you can do the HIFU and then finish that off with the Frax. And one of the other treatments I like to do a lot is boost the skin with hyaluronic acid. I like to do that before I treat with the Frax, particularly if I'm treating for rejuvenation and dermal remodeling with the 1550, because remember, these wavelengths rely on water as a chromophore. So the more we increase the hydration status and the water content of the skin through, for example, the use of the hyaluronic acid, low molecular injections, we are going to have better tissue interaction. And lastly, which is a very, very important point and an important part of my daily clinical practice, and that is that the Frax 1940 can also act as a cosmeceutical or a drug delivery. Because if you remember one of the first slides that I showed you about the histology, where you get the cracks in the superficial part of the epidermis, which allows for enhanced absorption and delivery of topicals that are applied on the skin, and therefore it is very suitable for cosmeceutical delivery. So transdermal cosmeceutical or drug delivery is something that is very close to my heart. And we know from data that was published and done on the 1927 nanometer wavelength, and remember the 1940 has higher water absorption compared to the 1927, we know that there is enhanced transepidermal delivery through the cracks, shall we say, that you get, the microscopic cracks that we get in the epidermis. And therefore, the 1940, which as I say, is closer to the 1935 compared to the 1927, and gives us a compatible histological response in terms of these microscopic cracks that you see in the epidermis, giving rise to the microscopic epidermal necrotic debris that clears the pigmentation, but also allows for enhanced absorption of topicals, is something that I use a lot. And therefore, you can combine the 1940 with examples such as tranexamic acid serum, particularly useful for melasma, vitamin C, particularly for general pigmentation, photo damage, and general brightening, and low cross or non-cross linked hyaluronic acid, more for deeper hydration or a glow. So there are different types of cosmeceuticals that you can use after the 1940 based on what you're actually wanting to achieve. As I said, this topic of laser-assisted drug delivery or cosmeceutical delivery is something very close to my heart, and I have done research on it, and this is one of my recent articles on what we have learned from having a decade-long experience with laser-assisted drug delivery. And I was, years ago, part of an international study on a split-faced study, albeit with a fractional ablative, with cosmeceuticals delivery. So I know how important the combination of cosmeceutical post-laser is. If we then look at the 1940, this was a publication that was published with the low-powered 1927, where enhanced absorption of topical antioxidants was seen following the use of low-density 1927. And what it shows essentially is basically if you apply, let's say, a vitamin C serum on the skin, you're going to get a degree of absorption. But if you pre-treat with a 1927 in this case, and then apply the vitamin C, you are going to have much higher absorption. And that is because when we use these wavelengths, the 1927 or the 1940, we get also these micro channels. You can see this beautiful image of the dilatation of these channels, which allows for enhanced absorption and delivery of the cosmeceutical. And this is where it showed, particularly for this product, which is an antioxidant, a triple antioxidant, that pre-treatment with the 1927 led to 17 times increased absorption. So we could extract this data, transfer that to the 1940, which we know it gives us the same response histologically and clinically. I have experience with the 1977 also, that by pre-treating with a 1940, there's going to be enhanced cosmeceutical and drug delivery absorption. And this is what I have done in practice. So this is my patient. So in this case, she wants the brightening. She wants smooth skin, baby soft skin, but she also wants to get rid of the pigment. So she's ideally suitable for the 1940 plus intense topical vitamin C serum delivery, and you can see the results. And I hope that you are able to see, even though sometimes it's difficult to show that on a clinical image, you can see just the smoothening of the skin, the glow of the skin, and not just improvements in the pigmentation. Here again, so that is 1940 fracs followed by vitamin C serum. Again, close up view. And in this case is a more mature skin, and you can see it's more mature skin and therefore requires more of that hydration. So this is an example where, of course, you can also use the vitamin C serum here, but this is an example where, in addition to the 1940 to just give us that glow, you can add in the hyaluronic acid boosters. By the way, this patient's also very suitable for the 1550 in combination with the 1940. So you can treat with the 1550. In her case, she has had previous treatments, but she wanted really to just try the 1940, which she absolutely loves. But you can certainly treat here with the 1550, followed immediately in the same session by the 1940 handpiece, and then applying the hyaluronic acid boosters. Close up view. And you can see that the improvement also in the texture. And this is all non-ablative. Of course, you can say, well, I can get this with the core CO2 from Candela, for example. Yes, I agree. But we're talking about a very completely different treatment. We're talking about an ablative treatment with downtime and potential risks. Here we're talking about a non-ablative treatment with much less downtime and much lower risk for complications. Another example where I use the Frax Pro, the 1940 handpiece, in combination with topical cosmeceutical delivery. So here, low fluence, low density 1940 plus topical tranexamic acid, particularly good for epidermal melasma, even in higher skin types. Another example here. So and look just at also the improvement in the skin, the glow. So here, in addition, obviously, with the topical sunscreen and the lightening cream, which she was already on, she was using already lightening cream and sunblock with some progress. So on the left is what she was after using sunblock and a lightening cream. But by using the 1940 plus topical tranexamic acid, you get this beautiful result, but you get clearance of the skin, smoothening of the skin, brightening of the skin, and also improvement in that superficial melasma. This is just a single session. Again, patient very happy, low downtime, improvements, smoothening of the skin, a nice healthy glow with less sun damage. And once again, yes, I know that this can be achieved with a pigment-specific laser or an IPL, which I have a lot of experience with both, but the difference is that in addition to clearing the pigmentation, the Frax Pro 1940 in particular gives us the smoothing of the skin, that softening, the glow, something that you appreciate when you actually just touch the skin. Another example, and this is just a single session. Patients can, of course, expect better results with having more sessions. Here, this is an example where I said you can combine with the HIFU. So if you can see, there is pre-jowl, there's heaviness and tissue laxity in the lower face. So this was a treatment with a high-intensity focused ultrasound, and then finishing that off with the Frax 1940. And look at the tightening, the lifting, but also the glow and the smoothing of the skin. Look at the remarkable transformation and the difference from the left to the right and close-up view. So of course, and this is why I think I love this device a lot, is because we all have those patients, need a bit of lifting, but the HIFU is only going to lift. They want also that brightening, the smoother skin, the softer skin, and that's where you can combine. Also on the back of the hand. So this is where I say I really like the fact that you can adjust the scanner width, something that you cannot do with the other devices with compatible wavelengths. So here, for example, you can I choose the 4mm diameter on the individual lentigos. I go with a high density, and then I just run over these lentigos with few passes. It literally just takes you minutes. So I know that each individual lentigo has really had intense treatments. Remember, when I choose the 4mm diameter, narrow scanner width, the spots are close to each other. So with high density, it's very intense treatment. Then I finish off with the 12 or the 10mm diameter scanner width, lower density, a couple of passes overall on the whole hand. And you can see the clearance. This is a single session. And it's very easy to just say, well, we're going to do another session. And again, you can combine that with injectables overall to improve on the appearance. So another nice niche for the Frax 1940, in addition to the face, the chest and décolletage, is also the back of the hands. This is a skin type 6, and I do have many patients with higher skin types. And this is a hypertrophic scar on the face. So here, I tend to use dilute steroids mixed with hyaluronidase for scars on the face, hypertrophic scars on the face, and a little bit of 1940 just for the texture, but also delivery of the tranexamic acid serum afterwards, also to reduce and clear some of that pigmentation. This is a flat seborrheic keratosis that you can again use the trick of narrow scanner with high density multiple passes. Mild rhinophyma, something I can have a lot of experience with rhinophyma, and I use the CO2, but here, just in this case, with this mild rhinophyma, where there's also erythema, low dose isotretinoin in combination with the V-beam for the vascular component, and then a bit of Frax Pro for improvement of texture. Pigmentation on the lip with the Frax 1940. And you can see here again, you can see that discoloration and that improvements. And again, just very low density, low fluence, and then apply the antioxidants. And it's very nice, again, for that plumping. We know that the 1550 is being used for plumping of the lips and rejuvenation of the lips, but adding the 1940, particularly for this discoloration and pigmentation, is an extra advantage. So coming back to Sharon, who I initially showed, why was she pleased? She's pleased because here we have no change really in the collagen, as in I use the 1940 and we are not specifically looking at collagen remodeling, but she's very pleased because she has this glow, smooth skin and shiny skin, and she's getting many compliments. Now, that's important because if you only have to attend one cosmetic conference or a dermatology conference to then understand what is the ideal skin of beauty, what is a beautiful skin, and that is skin that is smooth, porcelain-like, with a glow, nice light reflection, even tone, skin that is free of pigment or redness, free of blemishes, and for female patients when the makeup sits nicely. And if you look at what the Frax 1940 can do, it ticks many boxes of achieving the ideal skin. We get smooth skin with a glow, with nice light reflection, even tone, and this is why patients who have the treatments get the compliments and feel happy. And that is because we know from physics that there are two kinds of reflections, light reflection. There is the diffuse reflection that you see on the right-hand side when you have an uneven, rough surface, but you have the nice specular reflection when you have a smooth surface. So when you have a smooth surface, you're going to get this nice specular reflection. So why is the image on the left-hand side prettier than the right? And that is because the light's reflection is more specular and smooth on the left-hand side because of the way the water is, whereas because it's wavy water surface, the reflection is going to be diffuse and we're not going to get the same nice image. So here again, we see that when we have a smooth surface, we're going to get nice, even light reflection, which is specular reflection. And this explains why even these rocks, these pebbles, are exactly the same. If we talk about collagen, the collagen here is the same, but the only reason we like the look of the stones on the left-hand side, or they appear prettier, is because they are wet and they have nice specular light reflection. And that nice, even specular light reflection is a sign of beauty. And if you think that this is just my personal opinion, well, there is scientific evidence for this. That there are studies looking at how we perceive people as attractive based on their facial radiance. So people with smoother skin who have specular reflection of the light are simply perceived as more attractive. Even further, there was a study using imaging, looking at the human brain activity that is increased when we look at someone beautiful. So this was a study where they showed they did imaging of the brain, but they showed different images, and the images of patients who have smooth skin with nice specular light reflection were being scored as more attractive. So we know that if you achieve smooth skin with a nice glow that gives you, as a result of that, a specular light reflection, this patient is going to be more attractive. And why am I saying this? And that is because with the 1940, we are going to get that smoothening of the stratum corneum of the epidermis, and as a result of the effects of the Frax 1940 on the surface of the skin, we are going to get more that specular light reflection, which is giving the glow, and this is what's making patients such as this patient very happy. So by using the Frax 1940, improving the quality and texture of the epidermis, smoothing the stratum corneum, okay, and getting that more homogeneous specular light reflection, is going to appear more attractive. So how do I introduce the Frax 1940 in my practice? For those patients who want a smoother skin with a glow, but they don't want the ablative laser. Those women who want an even tone, particularly when they say, I want the makeup to sit nicely. This is actually something I learned. So after I do the Frax 1940, I'll ask them, is the makeup sitting nicely. For those who want a freshener of the skin, so let's say someone says, I have a wedding next month, I want to look better. There's very little you could do in terms of treatments that can really give you that fast result before a wedding. Frax 1940 with some cosmeceuticals for brightening is going to be the ideal choice of treatment in this case. And also, it's good for areas that traditionally were a challenge, which is the neck, chest, and the back of the hands. So once again, coming to the questions that I posed in the beginning, and I hope you'll be able to score them all. So the reason, which ones are prettier? Now, I hope you will choose A, and that is simply because of the specular light reflection, because of the smooth surface. Would lower fluence 1064 peak away works in a similar fashion as to the 532 in terms of depth? The answer is no, because we know that these are two different wavelengths. The absorption of melon to the 532 is higher than that of the 1064. So you can't just say, I'll use lower fluence 1064 and be same with 532. So once again, this is important because the 1550 has lower water absorption compared to the 1940. So you cannot just say, well, I will use low fluence 1550 and I will therefore simulate the 1940. It does not work that way. And lastly, why would Sharon, in this case, on the left-hand side, if she presented to you, really benefit from more collagen or collagen-based treatments, or just simply giving her a better tone, clear the pigments, and give her nice specular reflection? The reason I'm mentioning this is because we talk a lot about collagen-based treatments. We talk about fractional laser. Oh, yeah, it's going to improve the collagen. Microneedling RF or radio frequency. Yeah, oh, it's going to improve on the collagen. But I doubt that Sharon is, if I would say to her, well, I'll give you 20% more improvements in the collagen, or I can give you this, which one would you choose? I know what she would choose. So there is a shift. Not everything is collagen. Of course, collagen is important, but we have a great wavelength for that, and that is the 1550. But we also have to understand what is facial beauty and why are some people perceived as more attractive. And that is when you give them a smooth skin with an even tone. So this is my clinical bulletin, white paper that I published, which you can find on the from the Candela website sources on the use of the Frax 1940, and I have also giving you some of my parameters and settings. So in conclusion, the Frax Pro is a sophisticated fractional non-ablative laser that has two wavelengths, the 1550 for deeper dermal remodeling for scars, stretch marks, dilated pores, and the 1940, which is more superficial, ideal for microscopic epidermal ablation, which is great for glow, even tone, and texture. Also, the Frax 1940 is good for enhanced delivery of cosmeceuticals and drugs, and as I said, it can be combined with those treatments. Now, lastly, remember there are some features of the device that have advantages over other devices in the market, and that is the cooling is built in, there is adjustable scanner beam width, and no consumables. So with that, I would like to thank you all for listening, and I hope you enjoyed my webinar.